The year 2020 brought a new word into our lives, COVID-19. This virus, first identified in Wuhan, China, quickly spread across the globe, becoming a pandemic. India, with its dense population, faced an unprecedented challenge. The virus threatened not just health, but also the social and economic fabric. The first case in India was reported on January 30th, 2020, in Kerala. Kerala, known for its robust healthcare system, had been on high alert. The patient, a medical student from Wuhan, was quarantined and contact tracing was initiated. However, the virus had already begun its silent spread. As cases rose, a sense of urgency gripped the nation. The government, led by Prime Minister Modi, took swift action. On March 24th, 2020, India announced a nationwide lockdown. This measure aimed to slow the virus's spread and prepare the healthcare system. The lockdown brought its own set of challenges. Millions of migrant workers found themselves stranded. Their livelihoods vanished overnight. The pandemic was not just a health crisis, it was a human crisis. India's initial response to the pandemic was marked by a combination of decisive action and proactive measures. The government's strategy focused on containment and mitigation. One of the first steps was to establish a high-level task force comprising experts from various fields, including public health, epidemiology, and disaster management. This task force was responsible for coordinating the national response, providing scientific guidance, and disseminating information to the public.
Recognizing the importance of early detection and isolation, India rapidly scaled up its testing capacity. From a handful of labs in January 2020, the country ramped up its testing infrastructure to include over 3,000 government and private labs. This massive effort allowed India to conduct millions of tests, identify infected individuals, and trace their contacts.
The government launched a nationwide public awareness campaign to educate citizens about the virus, its symptoms, and preventive measures. Using traditional media like television and radio, as well as social media platforms, the campaign reached even the remotest corners of the country. Messages emphasizing hand hygiene, mask wearing, and social distancing became ubiquitous. The COVID-19 pandemic placed an immense strain on India's healthcare system. The country, already grappling with a shortage of doctors, nurses, and hospital beds, faced an unprecedented surge in demand for medical care. Hospitals in major cities like Delhi and Mumbai were overwhelmed with patients, their corridors filled with the sick and the dying. The pandemic exposed the stark inequalities in access to healthcare. While private hospitals, catering to the affluent, were better equipped to handle the influx of patients, government hospitals, serving the majority of the population, struggled to cope. The shortage of ventilators, oxygen concentrators, and essential medicines became a matter of life and death.
The pandemic also took a toll on the mental health of healthcare workers. Doctors, nurses, and other frontline workers, working tirelessly in stressful and often hazardous conditions, experienced burnout, anxiety, and depression. The pandemic highlighted the need for greater investment in healthcare infrastructure and the well-being of healthcare professionals.
The images of these exhausted and desperate travelers shook the nation's conscience. The lockdown's most heart-wrenching consequence was the plight of India's migrant workers. With factories shut down, millions found themselves jobless and stranded. The lockdown triggered a mass exodus, unseen since the partition in 1947.
The government set up relief camps and special trains to transport workers. Many workers faced uncertain and arduous journeys. Section 5. A nation embraces a lockdown. The nationwide lockdown, while disruptive, played a crucial role in slowing the spread of the virus. With public gatherings banned, schools and colleges closed, and non-essential travel restricted, India witnessed a significant drop in the rate of new infections. The lockdown bought precious time for the government to ramp up healthcare infrastructure, procure medical supplies, and prepare for a potential surge in cases. The lockdown also provided an opportunity for India to leverage its technological prowess in the fight against the pandemic. The government launched the Arogya Setu, or Health Bridge mobile application, a contact tracing app that used Bluetooth technology to alert users if they had come in contact with someone who had tested positive for COVID-19. The app, downloaded by millions of Indians, played a significant role in contact tracing and breaking the chain of transmission. Section 6. The second wave and its fury. Just as India began to ease lockdown restrictions and witness a decline in cases, a devastating second wave of the pandemic hit the country in early 2021. This time, the virus, fueled by new and more transmissible variants, spread with ferocious speed, overwhelming the healthcare system and pushing the country to the brink. Hospitals ran out of beds, oxygen, and essential medicines. The death toll soared, crematoriums were overwhelmed, and the air was thick with the smell of funeral pyres. The second wave exposed the vulnerabilities of India's healthcare system and the limitations of its infrastructure. The international community rallied to India's aid, sending oxygen concentrators, ventilators, and other medical supplies. The government, learning from the experiences of the first wave, ramped up testing and vaccination efforts, imposed localized lockdowns, and launched a massive public awareness campaign. Section 7. A shield of vaccines. India, home to the world's largest vaccine manufacturer, the Serum Institute of India, played a pivotal role in the global fight against the pandemic. The country launched its vaccination drive in January 2021, initially prioritizing healthcare workers, frontline workers, and senior citizens.
Facing the daunting task of vaccinating its vast population, India adopted a two-pronged approach. It granted emergency use authorization to 2 vaccines: Covishield, developed by Oxford AstraZeneca and manufactured by the Serum Institute of India, and Covaxin, an indigenously developed vaccine by Bharat Biotech.
The vaccination drive, however, faced challenges, including vaccine hesitancy, supply chain bottlenecks, and the logistical difficulties of reaching remote areas. Despite these obstacles, India administered over 1 billion vaccine doses, a testament to its manufacturing capacity, logistical expertise, and the commitment of its healthcare workers. Section 8. Lessons etched in resilience. India's battle against COVID-19 has been a saga of resilience, innovation, and collective action. The pandemic tested the nation's resolve, but it also showcased its strengths. From its decisive leadership and proactive measures to its scientific prowess and the compassion of its people, India demonstrated its ability to confront adversity. The pandemic underscored the importance of a robust public health system, the need for greater investment in healthcare infrastructure, and the significance of international cooperation. India's experience provides valuable lessons for the world as it grapples with the ongoing pandemic and prepares for future health crises. The pandemic also highlighted the power of human resilience and the indomitable spirit of the Indian people. From healthcare workers working tirelessly on the front lines to ordinary citizens extending a helping hand to those in need, India's response to the pandemic was a testament to its collective strength and empathy. Section 9. The unending battle. While India has made significant strides in its fight against COVID-19, the battle is far from over. The virus continues to circulate, and the emergence of new variants poses an ongoing threat. The government remains vigilant, monitoring the situation closely and adapting its strategies as needed.
India continues to ramp up its vaccination efforts, expand healthcare infrastructure, and strengthen surveillance systems to detect and respond to new outbreaks. The focus is on ensuring equitable access to vaccines, particularly in rural and remote areas, and addressing vaccine hesitancy through targeted communication campaigns.
The pandemic has underscored the importance of public health infrastructure. The government is working to strengthen disease surveillance systems, enhance laboratory capacity, and train healthcare workers to better prepare for future health emergencies. Section 10. A future fortified by experience. India's experience with COVID-19 has been a journey of challenges and triumphs. The pandemic tested the nation's resilience, exposed its vulnerabilities, and revealed its hidden strengths. It has been a stark reminder of the importance of public health, the interconnectedness of our world, and the power of human spirit. As India emerges from the shadow of the pandemic, it carries with it valuable lessons that will shape its future. The country is committed to building a more resilient healthcare system, strengthening its public health infrastructure, and leveraging technology to improve disease surveillance and response. India's story is a testament to the power of collective action, the importance of scientific temper, and the enduring spirit of humanity. It is a story that offers hope and inspiration to the world as we navigate the uncharted waters of a post-pandemic world.